Hello, everybody. My name's Ed Pavlik, and I'm in Lexington, Kentucky, where we're in the midst of spring and things are blooming, and we're all happy. My colleague today is,
Frank Lawton from London, UK, and ditto. Spring is in the air. We've got sunshine. It's going to be very warm for the next few days. Then, being England, of course, or Britain, it'll start raining again. But at the moment, it's very, very pleasant.
well, today we're going to consider the question, does pelvic inflammatory disease contribute to the risk of developing a borderline ovarian tumor, especially a serous borderline ovarian tumor? Answer to this question is approached in a paper titled Pelvic Inflammatory Disease and Risk of Borderline Ovarian Tumors, a national population-based case control study in Sweden, which was published recently in the International Journal of Cancer. With that being said, let me simply say that the numbers are small in this paper. And what I mean by that is right here. And that's that when we look at this problem, and basically I should point out that we're going to look at the odds ratio in two groups, a group with that has borderline ovarian tumors and a group that doesn't. And then we're going to look for the odds ratio risk of pelvic inflammatory disease in each of those two groups. This is different from looking for the odds ratio risk of malignancy. We're going to do it from this particular angle, not that it's terribly invaluable or valuable, but that's simply the way the paper was done. When we look at everything, we're talking about people who either never had pelvic inflammatory disease or ever had it, and so that's a clear distinction. Basically, there's about a 1.5, 1.6, or rather 60%, 50% risk of a pelvic inflammatory disease episode occurring in someone who's had a borderline ovarian tumor that doesn't occur in people who've never had a borderline ovarian tumor. And so that all takes place as an increase over the number of episodes according to the paper. And so if you look at this slide, we're talking about 0, 1, 2, or 3 or more episodes. And we have a numbers problem where what I've identified in yellow really doesn't play out as statistically significant. There are no significant attached to any of these figures, and you can see the overlap with the confidence interval. That basically this only one episode, basically the odds ratio really overlaps based upon confidence interval with three or more episodes. So that data isn't terrifically strong. What they did seem to find is that in particularly pelvic inflammatory disease occurred in people who had serous borderline tumors, but not those with mucinous, and that's right here. But really what we're looking at is a odds ratio that's based upon a percentage that's pretty low, basically a 1% difference between the groups. And, that leads to when you divide this percentage by this percentage of 1.6. So, this is not something that's terribly impressive. Overall, what they're really saying, is what they expect to happen is that infectious agents, which can cause inflammation, enter and get up into the fallopian tube and cause some sort of event or defect that leads to stick formation, which leads to ovarian cancer. And that's pretty convenient, for someone to say because it relates to some popular opinions. But, let's face it, microorganisms that come in to the pelvic area are going to cause inflammation internally in the uterus and the vagina, fallopian tube. Now, they did do a good job of, differentiating these areas based upon medical codes. But nevertheless, the paper really emphasizes the fallopian tube as the site of some sort of inflammation. And, really their data says inflammation anywhere is related to the effects that they're measuring. And so the bottom line is that I think the paper is a concordant with previous reports who've sort of said the same thing. I think to its credit, it tries to distinguish between different regions of the pelvis that could be inflamed. But I'm, sort of a little bit unhappy with the fact that they then decided they would emphasize the fallopian tube areas for pelvic inflammation. So once again, there's nothing to argue with here. It's just basically, repeats what's already been said and makes some improvement. And I'd say stretches reality a little bit in terms of how they present it. Frank, what do you think?
Yes, I think that's a very good point. I mean, obviously the data, the Swedish data are very good. And I'm surprised that the infective agent hasn't been recorded at all. I mean, they talk about salpingitis, oophorytis, whatever that is, endometritis. They haven't looked at other causative factors such as endometriosis or widespread pelvic inflammatory disease. They've not looked at smoking, contraceptive use, fertility or fertility treatment for patients who've had borderline tumors. And the other thing, of course, is in a way, does this encourage the Swedish health authorities to label patients with pelvic inflammatory disease at risk of a borderline tumor? And if so, what are they going to do about it from a monitoring point of view? And are they worried, and there aren't a lot of data at all that suggests this, are they worried that a borderline ovarian tumor, if untreated, will become an invasive malignant ovarian tumor? And I think the jury is out on that. I don't think there's a lot of evidence that a borderline tumor is pre-malignant. It's a different, if it's a different entity. So I think that as you say, it's quite interesting. I'm not sure what a clinician would do with the data. If someone presents with PID, are they then put on some sort of screening program to determine whether or not they've got ovarian problems? If so, can they tell the difference between a swollen fallopian tube and an endometrioma? So I think the data is interesting, but I don't think it. I don't think we can carry it on any further. There's nothing more to be said. Yes, that's fine. There may be a link. And the other thing, of course, is the reason why they think that it may involve serous tumors is that the serous tumors probably arise from the fallopian tube, whereas the mucinous tumors probably arise from endocervical tissue or endocervical embryonic tissue. But as you say, the pelvic inflammatory disease doesn't just get to it doesn't stop at the cervix, and it doesn't stop when it reaches the fallopian tube. So it's a global pelvic infection or pelvic organ infection, but producing a borderline ovarian tumor. And I'm not sure those data actually agree with each other.
Yeah, and I will point out that anybody who looks at the paper shouldn't be impressed by there were about 5,000 cases out of 44,000 that were being used, but the ones that fell into the ever having pelvic inflammation were under 194 cases. So we're talking about the candidate population versus the actual population for experimental determinations. And once again, under 100 cases is really what everything is based on. And
Yeah. Yeah.
it's been published, and that's the way it is, but that has to deal a little bit with what people buy into. It also speaks to just what you said, is that in the scheme of things, pelvic inflammation in a reporting sense is relatively rare if we take these numbers, which means maybe if someone could divine all the unreported cases of pelvic inflammation, this might have some, greater meaning. And I don't dismiss that. It's just that the reported cases for this paper are quite small.
Sure. Yeah. Yeah.
Well, we've done it again, Frank. Enjoyed being with you. We'll do it again next month
We will indeed. I shall see you in when are we? May. Yeah.
in May. Very, very good.